Welcome back to Auralith Wellness. Burning feet, tingling toes, sudden numbness, or maybe it feels like you're walking on broken glass every time you take a step. If that sounds familiar, you are far from alone. Millions of people live with peripheral neuropathy, especially after the age of 60. But here's something many people never hear from the beginning. Damaged nerves are not always beyond repair. Researchers studying neuropathy patients discovered something remarkable. After consistent exercise therapy, nerve fibers actually began growing back, not just symptom relief, real physical nerve regeneration observed under a microscope. And today you'll learn 6 simple home exercises that may help stimulate circulation, activate nerve pathways, improve balance, and support natural healing. You don't need a gym, you don't need expensive equipment. All you need is a sturdy chair and a few minutes every day. Your peripheral nerves work like electrical cables running from your spinal cord down through your legs and feet. These nerves carry messages about pain, temperature, pressure, balance, movement, and your body's position in space. When those nerves become damaged, communication breaks down. Instead of clear signals, your brain receives confusion and interference. That's when symptoms begin. Burning, pins and needles, numbness, weakness, sharp pain, loss of balance. The most common cause is diabetes, which accounts for a large percentage of neuropathy cases. High blood sugar damages delicate nerve tissue over time through inflammation and protein damage. But neuropathy is not caused by diabetes alone. Other common triggers include vitamin B12 deficiency, alcohol use, certain medications, chemotherapy, autoimmune diseases, poor circulation, obesity, and chronic inflammation. Sometimes, doctors never identify an exact cause at all. And here's something many people don't realize. Too much vitamin B6 can actually worsen neuropathy symptoms. High-dose supplements may irritate nerves instead of helping them. Now here's the encouraging part. The nervous system has the ability to adapt, and with the right kind of movement, nerves may begin reconnecting and functioning more efficiently again. Stay with us because one of the exercises later in this video is specifically designed to retrain balance and reduce fall risk, something incredibly important for anyone experiencing numbness in the feet. Before we begin the exercises, let's briefly talk about natural support for nerve health. One supplement that continues to show promising research is alpha-lipoic acid. Several studies suggest it may help reduce burning and tingling sensations when used consistently. Vitamin B12 is also essential for healthy nerve function, and if you take medications like metformin or acid reducers regularly, checking your B12 levels with your healthcare provider may be worthwhile. Nutrition also matters more than many people realize. Foods that support nerve health include fatty fish, leafy greens, nuts and seeds, colorful vegetables, and healthy hydration. At the same time, reducing excess sugar, processed foods, trans fats, and alcohol may help reduce inflammation that affects nerve tissue. Now let's begin with the first exercise. Sit tall in a sturdy chair. Keep your back upright instead of leaning backward. Now slowly lift one knee at a time like you're marching in place. Add arm movement naturally. Right arm with left knee, left arm with right knee. Keep a comfortable pace where your breathing increases slightly, but you can still speak normally. This movement helps increase circulation and oxygen delivery to the nerves. Start with just 3 minutes. Over time, Gradually increase toward 10 to 15 minutes once or twice daily. This is an excellent low-impact option, especially for people who don't feel stable walking outside. And here's why this matters so much. Neuropathy doesn't only affect sensation, it also interferes with your body's ability to know where your feet are positioned. That loss of awareness dramatically increases the risk of falling. Now let's begin retraining that balance system. Stand behind a chair and lightly hold the backrest. Shift your weight onto one foot, lift the opposite foot slightly off the ground. Hold. That's all you need to do. Your goal is eventually 30 seconds per side, but if you can only hold for 5 or 10 seconds at first, that's completely okay. Start where you are. As your balance improves, try using only one hand, then no hands, and eventually, if safe, briefly close your eyes. Closing the eyes challenges the nervous system even more because your body must rely on internal balance signals instead of visual cues. That process can help strengthen weakened communication pathways between the feet and the brain. Move slowly, stay safe, and never rush the progression. Now let's continue with another balance and sensory exercise. Stand with your feet shoulder-width apart. Hold onto the chair lightly. Slowly shift backward onto your heels so your toes lift slightly. Then smoothly shift forward onto your toes so your heels rise. Continue rocking gently back and forth. Perform 15 repetitions for 2 sets. This simple movement helps improve balance control, foot awareness, calf strength, and sensory stimulation. Every shift sends information from your feet back to your brain. You are literally retraining communication inside the nervous system. Most people focus only on pain when it comes to neuropathy, but another major issue is muscle weakening inside the feet themselves. And when those small muscles weaken, walking and stability become much harder over time. That's why the next exercises are so important. Stand behind your chair once again. Slowly rise up onto your toes. Hold for 2 seconds, then lower back down, slowly and gently. Perform 12 repetitions for 2 sets. Your calf muscles work like pumps for circulation. Every contraction helps move blood upward and encourages fresh, oxygen-rich blood to flow back into the feet. Better circulation means better support for nerve tissue. This movement also activates sensory nerve pathways running from your feet up through the spinal cord. As your strength improves, you can eventually try single-leg calf raises for a greater challenge. Now let's wake up the small muscles inside the feet. Sit in a chair and place a towel flat beneath your bare foot, using only your toes. Grab, scrunch, and pull the towel toward you. Repeat this motion 10 times per foot. At first, your toes may feel weak or uncoordinated. That's completely normal. In fact, that awkward feeling often means you're activating muscles and nerve pathways that haven't been properly stimulated in a long time. As control improves, you can make the exercise more advanced by picking up small objects like marbles or coins with your toes. This helps rebuild fine motor control and coordination. Now for one of the best mobility exercises for stiff ankles and poor circulation. Sit comfortably and lift one foot slightly off the floor. Slowly rotate your ankle, 10 circles clockwise, 10 counterclockwise. Move gently through the fullest comfortable range of motion. Then imagine your big toe is a pen. Write the alphabet slowly in the air. ABC. Every letter activates muscles and nerves from different angles. This exercise helps improve mobility, coordination, circulation, and neuromuscular control. Now let's make all 6 exercises simple to remember. Start with seated marching for your warm-up and circulation. Then move into balance. Work with the single leg hold and heel-to-toe rocks. Finish with foot activation, calf raises, towel scrunches, and ankle circles or the alphabet drill. Altogether, the routine takes about 15 minutes, and when possible, adding short outdoor walks can further support circulation and mobility. But there are 3 rules that determine whether these exercises truly help. First, start smaller than you think you need to. If the exercise says 12 repetitions, begin with 6. If it says 30 seconds, begin with 10. Nerves respond better to gradual stimulation than sudden overload. Second, consistency matters more than intensity. 15 minutes every day is far more effective than doing too much once a week. Nerves heal slowly, but they respond to repetition and routine. Third, always inspect your feet afterward. Check for redness, blisters, pressure points, or cuts. Reduced sensation can make injuries easy to miss. A quick daily check can prevent serious complications later. Science continues to show that the nervous system is capable of adaptation and change. Circulation can improve, balance can improve, strength can improve, and damaged nerve pathways may respond positively to consistent movement and healthy lifestyle habits. These exercises are simple, but practiced regularly, they may become a powerful part of your natural wellness routine. Here at Auralith Wellness, we focus on practical, research-based wellness strategies that support the body naturally. If you found this video helpful, make sure to like the video, subscribe, and leave a comment below telling us which exercise you're going to try first. And as always, speak with your healthcare professional before beginning any new exercise routine, especially if you have severe numbness, advanced diabetes, balance disorders, or foot ulcers. Take care of your nerves, and thank you for watching.